Me. Now, questions or comments?
Looking at the program, one thing that seems to be missing is actually, in terms of the urban environment, the adaptation of housing to and living, really housing in relation to ventilation, in relation to the reduction of any use of energy. That's sort of not addressed in here. I know that what's addressed is the transport system, and that's very good. And I'm wondering there if the advocacy of free transport, especially in the inner city areas, would be a good idea rather than fighting a lot over what mode of transport, but to actually make free transport, especially in the highly urbanized areas. And another comment that I have with hospital admissions, is it within a higher population and with increased obesity and diabetes, that those are factors that would simply account for higher admissions in themselves? In other words, greater population and in certain areas chronic diseases that are in the increase, quite apart from climate change.
There's certainly scope to improve housing standards within this country, and I know that there's significant work going on with Xiaoming and the CSIRO around improving housing standards within Australia. In terms of from a planning perspective, I think there's certainly scope to look at mandating increased and improved housing standards. The pushback will come from industry and other advocacy groups, which, you know, and they will talk about the increased cost, and the increased cost will be borne at the end by consumers. The other thing I think we need to look at is the fact that most of the vast, well, we all live in a house virtually at this point in time, so what we would really need to be doing is looking at retrofitting existing housing stock rather than building new housing stock. And so we need to be looking at how we can, I guess, improve the existing housing stock and look at reducing that reliance on air conditioning, for example. But you know, the housing stock in Australia is, when compared to certainly more energy efficient housing, is pretty poor. So I think there's a great deal of scope for that, certainly.
The work that Paula and I have done on the hospitalisations in Sydney, that was comparing extremely hot days to non-hot days. So those hospitalisations were increased on hot days, but certainly, as you mentioned, the underlying rate of chronic disease and just population growth, that in itself is having quite a significant impact on health services. And something that I thought Anthony was going to talk about today, health services planning, that's a focus that one of the main results that he came up with is that health service planners are actually focused on dealing with Australia's ageing population in terms of looking long term, but what they're not doing is actually thinking about the additional impacts that climate change might have on health service use. So certainly population growth and chronic disease are very, very important. And if you could actually, you know, take out chronic disease and take out ageing out of the equation, you wouldn't get much of an impact from climate change, in my opinion, because its greatest effects seem to be on people who do have chronic disease.
I think probably I didn't explain the statistical method that I used properly, so that's where the question might have come from. What I did was I had a time series of 18 years. I divided the time series into sections of 28 days. And then I looked where the extreme days, if they occurred in those strata, I matched them by day of the week to other 2 or 3 days. So I was comparing relatively same prevalence, population with relatively same prevalence of diabetes, because that way I didn't have to account for a long-term increase in diabetes or seasonal admissions. Does that explain?
The issue is often very much to do with active biological interaction between these coexistent circumstances. So you get amplification processes rather than just additive processes. And in fact, extremes of heat do have effects across the age range, very young children, people in the exposed workplaces, healthy midlife adults. If the conditions are extreme enough, you get quite serious organ damage, dehydration and so on, as well as behavioural disturbance. There's been a paper reported in the last week in one of the top journals, Nature or Science, about the association between extremes of temperature and violence. And we're going to see it, I think, with road rage and with poor judgment in the workplace, aggressive behaviours and things like that. So it's a pretty complex scene. Now we've got time for one more, if there's a question or comment.
I was just wondering about the young adults and their vulnerability, whether you had looked at interactions between alcohol consumption and heat stress.
No, I haven't looked at that. It definitely could have played some role. I suspect that I had a chance to look at the admissions for heat stroke and heat exhaustion by gender. And there seems to be more males in that younger group being admitted to hospital rather than the women. So which would sort of point to outdoor workers and possibly athletes. But I haven't been able to look at their associate conditions under which they were admitted, which could have information or if there is alcoholism or some other problem. But there won't be any information whether they actually drink on that day. There will be in-hospital admissions data, only information whether they actually have a medical condition related to alcohol.
Okay, we've got a final question over here. Scott, you've been outbid, I'm afraid. You have to keep it to morning tea.
I'm used to it.
I was just wondering if you know of anyone or any of your team looking at the differences between rural areas and urban areas. Have you got any comment about that?
There is definitely very limited information on impact of extreme heat in rural areas. It's probably because there is very little of data. There is small population. The hospital admissions are very rare, so therefore it's going to be very difficult to model what temperature they're exposed to, because meteorological stations are very scarcely sort of located in rural areas. The populations may be far away from the meteorological station, so there's a number of things why it's really difficult. But definitely it's a next step to do. Look at these. With hospitalizations, we have better chance to do some modeling because there's more hospitalizations than death, obviously.